my life's work, and it has been my lifetime of over 45 years of work in developing an approach for the healing of trauma. And this approach really helps people come back to their bodies, because after trauma, the body has become the enemy. The sensations and the feelings remind the person of the trauma that it's going to happen again. The key in healing trauma is not to relive the trauma experience, but to create new experiences in the body that contradict those feelings of overwhelming helplessness that happens in trauma. So it's having new experiences, really, is what it's about. And that's where I became interested in the work with the bellicon, because it's a way to very gently, in a playful way, begin to bring people back a little bit more and more to their bodies. So I use it as part of a treatment, but I also recommend it for a number of my students. Use it in teaching, and clients use it to use at home as a way of again, finding a peaceful, vibrant way to reconnect with themselves in a physical way. The smooth movements are the key, because if it's something that's hard, like the trampolines that have springs, what happens is it really jars the person, but that's what trauma does. It shakes the person, it shakes them out of their body. So you want something that gradually brings them back into their body, and that's where the elastic technology that people have developed is very valuable. It really allows this gentle reconnection, and you don't get that with if you have the springs. It's more like it's more like getting a Schleuder trauma. With many of the people we work with also have Schleuder trauma, and that's another area where it's very useful, because again, if they're in the car, somebody comes from behind and they go like this. And so the whole body locks up, because the body is protecting itself from being hit again. So again, in the bellicon, if you can create a movement that uses similar muscles, similar neuromuscular connections, but in a different way, in a way where you get flow, then it neutralizes, in a way, the shock that you get from being hit in the car, from the Schleuder trauma. I do a lot of work with people who have depression. And again, with depression, you have to help the person get their energy level up, but only a small amount at a time, because if they go up too quickly, they get frightened. So it's a way of building the capacity for the person to increase their vital energy. In a way, it works much better than most antidepressant medications. Not that you don't sometimes need to use those as well. And as I said, with trauma, the main use is to give people back the gift of their bodies. And maybe that's the best way to say it. It's the gift of our embodied self and our capacity to be whole within our bodies. I call that embodied awareness, or embodied mindfulness.